Well, we have Dr. Nikhil with us, we have Dr. Vineet with us, and also Dr. Satish. We'll be talking about OAB for the matter, and we'll be making sure that the very important pointers of OAB is getting delivered to all our viewers. Well, to be started with Dr. Nikhil, would be asking you, for a layman, what would be the definition, a real definition of OAB? What is it?
See, OAB, the full form is overactive bladder.
Yes.
So it means that when the bladder needs to be silent, that is when we are filling our bladders, like we are sitting now, the kidneys are pouring urine drop by drop in the bladder. So bladder needs to be silent. But when silence is required, it is getting overactive. So it is contracting and trying to push the urine out when we are trying to store the urine. So that is what gives the feeling of urgency and need to go to rush to the washroom. And in fact, if really urine leaks, then it becomes urgent incontinence.
So Dr. Vineet would like to know from you, how does this impact a person's social life, a patient's social life actually? Would like to add anything?
Overactive bladder may have a very deleterious effect on the social life of a person, especially if they are going very frequently. So now they may avoid going out altogether. They may start wearing incontinence pads or diapers. And there is one thing known as toilet mapping. Like wherever they go to a new place, it's a mall, a restaurant, they'll always do a mental mapping of where the nearest toilet is if they need to rush. So it does take a toll on the physical and mental well-being of a patient, and it is something which can be managed very easily, provided we create adequate awareness.
Right. Dr. Satish would like to know from you, what are the consequences if a person is or a patient is delaying the consult? He's making delay and not consulting to any particular doctor. What could be the consequences of that?
Well, apart from what the effect it could have on the bladder itself, like my friend Vineet said, it has a very deleterious effect on the quality of life. The quality of life is impaired to a great extent. And I would like to add to what he said, it may even lead to injuries in the patient. So an old patient rushing to the toilet, tripping down, having fractures, and that has a very grave effect on the patient.
Well, when we talk about the same thing, I would like to know from you, of course, what is the role of behavioral therapy when it comes to the OAB?
That is actually the first line of treatment.
Okay.
First of all, what habits, how just behavior can alter the situation and be beneficial for the patient is, like, first of all, we check the patient's behavior of intake of fluids. If the fluid intake is too much, or if the foods or the beverages that he or she is taking are caffeinated, carbonated, then they give rise to more overactive symptoms in the bladder. And so we need to inform the patient so that he can cut down the amount of fluid and the number of times that he or she is taking caffeinated beverages. Secondly, in this there is a need to correct constipation if there is, because that also has an effect. Then we need to train the patient to hold urine, if first of all, not to delay micturition, not to delay voiding, so that because they generally know that after which volumes it starts coming. So if we look at their bladder diary and we tell them that you try to go earlier, and then we tell them how to hold urine by doing some exercises. So when the urge comes, because urge, when it comes and then it intensifies and then it slowly comes down. So at that time they need to have their urge control, so that instead of rushing to the toilet when the urge subsides, they should walk to the toilet. So for that they have to develop the strength.
All right. Dr. We would like to know from you, what do you think would be the reason why people are delaying the consult? Is that the reason behind it, that people are thinking that it's not a very significant problem to be diagnosed? Would that be a reason?
Yeah, so before I answer that question, I just like to add one more thing.
Yes, please.
So it's a common fallacy in our country that any person with urinary problems should drink more water.
Yes.
So we are the only people who are telling people not to drink too much water.
Yeah,
because we see people drinking 4-5 liters of water, and the incontinence or the overactive bladder becoming worse. So it's important to drink adequate, correct amount of water, not too much water, which may further aggravate the situation. And sometimes only taking an adequate history of how much water they are taking helps to solve the problem. So it's a very important thing is adequate water intake.
How much is adequate?
Yeah, that is what I
Yes,
wanted
so
to ask.
adequate is what I tell my patients. There are two main parameters. Drink according to your thirst.
Okay.
Number one. Number two, if the color of urine is white or light yellow and it is not smelly, your water intake is fine.
It's good.
If it is dark yellow and smelly, that means you need to increase your water intake.
Okay.
Thirdly, the way water should be drunk. So it's a habit of people like to binge drink water, like they're having a beer or something. But the ideal way is have a glass of water, finish it over 1 hour. So if you drink water slowly, as Dr. Nikhil said, the kidneys will produce water slowly, the bladder will distend slowly, you're able to hold more urine. So symptoms of overactive bladder may be reduced. So this is another
Sudden
important
distension will cause more
More.
overactive.
But when you say water, you don't mean water, you mean all fluids.
all fluids.
All
Yeah.
fluids.
Actually, so we have to keep regular intervals in our water intake.
And not too much water in
Not
liquid
too much.
intake, yes.
So too much water, as in you have to consider the thirst, and the second point is the color of the urine.
And secondly,
Yes.
the profession. If somebody is working in the sun, he's sweating, he needs more water.
Yes, yes.
But we see people sitting in air-conditioned offices and drinking tea, coffee, water, and then they complain that we have overactive bladder. So that is what behavioral therapy is all about. So once you know their pattern of fluid and you control it, 50% of patients will not require any medication.
Your uro diary is if bladder diary is the main thing in your uro diary.
True. Thank you so much for being here, gentlemen. It was nice having a talk with all of you.
Thank you.
You sense